the front line of the battle against the bacteria. A ward in Hamburg with some of the victims of a novel type of E. coli, one that's emerged from a source that's still unknown. These are nervous times.
Es spielt doch irgendwo eine Angst mit, auch unter den Kollegen,
There is a fear among the staff, says this intensive care nurse. There are patients the same age as our children, and nobody knows where this is coming from or where it'll lead.
Es weiß ja noch keiner so richtig, wo kommt's her und wo geht die Reise hin.
Identifying the bacteria is the first task. It's one that's never caused an outbreak before. Analysis has revealed its virulence. Understanding it should help trace its source. And the quicker that's done, the faster it can be brought under control.
This is an unprecedented outbreak in its size. It's not quite the biggest ever in terms of number of cases, but it's certainly the biggest in terms of the health impact, the number of cases of people with complications, and I'm afraid it will probably be the biggest in terms of number of deaths as well.
Something about this outbreak means women are most vulnerable. No one knows why. Confirmed today is that the bacteria is a hybrid. That means two other types of E. coli combine to produce it. That may make it more dangerous. It can certainly stick to the wall of the gut and there produce the toxins that trigger a range of effects. The first of these is diarrhea, but more serious conditions can follow, including kidney failure and damage to the nervous system. So how can it be tackled? Well, antibiotics might not work. This strain is resistant to some. Strict hygiene keeps being stressed. And the incubation period is 8 days. So if people in Germany stopped eating raw vegetables last Friday, when the first warnings were issued, the number of new cases should fall pretty soon. So what are the risks of it spreading? This lab in London is on standby. 7 people in Britain are infected. At least 10 countries now have cases, but they all got it in Germany.
Fortunately, so far, all cases we have seen, and indeed other member states within Europe, they have all been associated with travel to Germany.
Tracking the bacteria involves detective work, finding out what the victims ate, where they got it from, how the contamination started. It'll be a long process. David Schuckman, BBC News.